Hi, my name is Isaac Mitchell, and I'm doing my presentation for this PSLO assignment on LGBTQ plus mental health equity. Just a couple of facts to get started here. LGBTQ plus people are an oppressed and discriminated against minority that experience increased rates of mental health issues, increased rates of discrimination, hate, abuse, violence, as well as increased rates of suicide and self harm. And a little bit on why I'm choosing this topic for my assignment. The LGBTQ population is vulnerable and experiences a lot of discrimination as well as increased rates of these disorders. So they're very relevant to the population and relevant to today. Also because there has been an increase in anti-LGBTQ legislature that includes things that are restricting access to gender assignment surgeries and things like that are important for this population for healthcare. And there's also been a rise of misinformation about LGBTQ plus topics. So I have a couple guiding questions to kind of keep in mind as I go through my slides here, which are what unique factors are impacting the queer community that either lead to increased mental health struggles or decreased access to mental health care. So those are kind of the two ways it can go. They can be making mental health worse for this group or making it harder for them to get access to care. And then finally, what are some things that we as nurses can do to mitigate these factors and make that a little bit easier on this community? For the impacts on safety in this topic, the main safety risk is to the patients themselves. Risk of self harm or suicide for LGBTQ plus patients. In a 2023 survey of LGBTQ plus youth, 65.3%, so almost two-thirds, reported self harm, 73.8% reported suicidal ideation, and 25.7%, just a little bit over a quarter, reported suicide attempts. So this is definitely something that really impacts this group, especially youth. The impact on healthcare quality for LGBTQ people is that many providers are not educated on specific topics for this group and how to best help their patients. So that can lower the quality of healthcare. If your provider isn't up to date on things like that, and people who are experiencing discrimination in the healthcare setting, they might just avoid care altogether. If someone's being misgendered at their doctor's office, they might just not get care. Mental health care is part of your holistic health, treating the person as a whole human and kind of like as a collection of all these different systems. Stress caused by discrimination and abuse and violence, the increased rates of those, the LGBTQ population all experiences, as well as a lack of mental health support. They can impact mental health and physical health as well. Chronic stress that can be caused by things like discrimination can also contribute to chronic illnesses and other health issues. So let's take a minute to focus on some laws, regulations, and policies that impact LGBTQ plus mental health. As I mentioned earlier, there's been a rise of anti-LGBTQ legislature introduced over the past couple of years. So this is a little chart from Trans Legislation Tracker. And this is the number of bills that are targeting access to gender affirming care by year. And you can see in 2018, there were 2 bills introduced. And this year, it's currently November, there are 184 introduced this year, which, you know, I'm sure we're going to have one or two more by the end of the year. So we'll probably have more than last year. And yeah, so those are definitely on the rise. For a little look into how those anti-LGBTQ bills that are being introduced are impacting the population. In a study by the Trevor Project, which sent out a survey, they found that 9 out of 10 transgender and non binary youth reported worsening mental health due to these legislation that are introduced. Another factor that impacts LGBTQ youth is transgender conversion therapy. It is not scientifically supported and it is ineffective as well as harmful, but it is only banned fully for minors in 23 states. So there are 27 states that it is not fully banned in. 13% of LGBTQ youth reported being threatened with conversion therapy, and of the total LGBTQ youth that attempted suicide, 27% were threatened with and 27% were subjected to conversion therapy. So there's evidence that being subjected to or threatened with conversion therapy increases the risk of someone dying by suicide. So with many states introducing or, applying laws that restrict gender affirming care, that is another thing that impacts the mental health of LGBTQ people. A 2023 study found that early access to hormones and puberty blockers, which was within 12 months, is associated with a 60% reduction in depression and 73% reduction in self harm or suicidal ideation. Now, I'd like to focus on some of the financial barriers to getting mental health care that transgender people face. According to a 2023 study, LGBTQ plus adults were more likely to report having difficulty paying for health care. They were also more likely to report going without care due to being unable to pay for it. There's also the issue of insurance coverage because state Medicaid explicitly covers transgender related healthcare only in 26 states. So there are 24 states where it is not explicitly covered, and there are 10 states where it is explicitly excluded from the state Medicaid care. So not only do you have people struggling to pay for care, but you also have people who may not even be covered or may be excluded from the coverage. Another factor that impacts their ability to pay for mental health care and access mental health care is that LGBTQ people have an increased poverty rate compared to straight and cisgender people, with 22% of LGBTQ plus adults in the US living in poverty compared to 16% of straight and cisgender people. There's also an LGBTQ plus wage gap, and this depends a lot on many different factors. But trans women have, on average, make about 60 cents per dollar compared to the overall average wage, and trans men make about 70 cents per dollar. And in 2020, the Supreme Court, in the decision Bostock versus Clayton County, ruled that employment discrimination protections included LGBTQ plus people, but obviously workplace discrimination is still an issue. 47% of LGBTQ plus workers have experienced workplace harassment, and 33% of surveyed LGBTQ plus workers had left a job due to mistreatment by employers. So you have people who are, being paid on average less than the average worker, as well as increased rates of workplace discrimination, which can make it more difficult to have a job. And then that all of that combines to make healthcare a lot more difficult to afford and to pay for overall, especially in America, since so many people's insurance is tied to their job. That's another factor that could make this more difficult to pay for. Now that we understand a little bit more about the context that LGBTQ plus people are living in America, let's focus on some things that we as nurses can do to alleviate some of these problems. A good first step is to reflect on your personal biases. Everyone has some form of bias. Everyone has all these different biases and things like that internally. And exploring your own thoughts and feelings about LGBTQ plus people can really help you become more empathetic, understand where people are coming from, and provide better care. Learning about LGBTQ plus healthcare topics is also important so that when you do encounter them at work, you know what they are and you're able to have a conversation about them. Being informed about topics like gender identity, pronouns, dysmorphia, different things like that is really important for a healthcare worker. Knowing your workplace's policies about LGBTQ patients, as well as what resources are available for them, can all help you be more of a resource to your patients and be able to provide them with the help that they need. The third bullet point I have for how we as nurses can help the LGBTQ plus population is by reporting discrimination and encouraging accountability in our workplaces. This can include calling out discrimination when you see it, not laughing at someone's joke that they make that's punching down at LGBTQ plus people, or bringing up discrimination or harassment to your supervisors according to your workplace's protocols, things like that. Another thing that is important for nurses to do is to advocate for a legislature that protects LGBTQ plus rights. So this can include staying up to date on anti-LGBTQ plus legislature that's introduced in your area, as well as knowing local advocacy groups and kind of seeing what different causes that they're working on and getting involved. It's always important to know what resources are available for specific groups. Knowing LGBTQ plus specific resources will really help you when you have patients that fit that demographic. Some examples of this could include knowing what therapists in your area specialize in LGBTQ plus topics so that you can refer them to them. There are also LGBTQ plus specific support groups. And an important one to know is that there is a national LGBTQ plus youth helpline, which is a suicide or crisis hotline specifically for queer youth. And it's ran by the Trevor Project, and I have the text number there. That's a good resource to have as well. In conclusion, LGBTQ plus people, especially youth, are a vulnerable population and they experience elevated rates of mental health issues, poverty, suicide, and self harm. Access to gender affirming care is a mental health issue because lack of access to this care negatively impacts people's mental health so badly. Anti LGBTQ sentiments and legislature are both on the rise. But despite all of this, there are things that nurses can do to make a positive impact and to make healthcare and mental health care safer and more accessible for LGBTQ plus people. Thank you.